know malaria continues to be a challenge in the hinterland regions, and this is one of the reasons why the Ministry of Health continues to be at the forefront in the support. Generally, we tend to work with local stakeholders, including persons from the villages within the different regions, 1, 7, 8, and 9 mainly, especially persons within the mining and logging community, to ensure that we can build collaboration with them. We understand that malaria over the years would have affected those within the mining and logging communities, and therefore it makes the Ministry of Health therefore have the mandate of working closely with them to build capacity and ensure that they roll out the different strategies. And key to this, of course, understanding that these are very far in very remote areas, is ensuring that there's adequate transportation. These sites are very far from hospitals and established services, and therefore it becomes a challenge getting persons out in time to access not only testing, but the necessary treatment. And we have a mandate to ensure that persons can access the services free of charge and ensure that they deliver to the best of our ability. And as a result of that, we work to ensure that transportation is improved. We do so with ATVs, boats, etc., working with the different communities, ensuring that they can access services. So at times, even though we build capacity within the mining camps, within the logging sites, we want to ensure that they can also come out should they have any emergencies, and that health workers can monitor these sites on a frequent basis, and that the integration of health service delivery could be achieved. So again, the Ministry of Health is committed to elimination of malaria, and in order to do that, we must continue to engage locally and to work as one community towards one common goal. Thank you.
Between the Ministry of Health and the Ministry of Local Government and Regional Development, alongside us here is the Minister of Amerindian Affairs. I'd like to say thanks to Global Health Fund, who has been assisting the Ministry of Health for the past 20 years in donating these two ATVs to regions 1 and 7, basically to deal with tuberculosis in the two regions. I want to thank them and continue with the good effort. Thank you.
On this very significant activity, which is to provide two hinterland regions with two ATVs that will support the fight against communicable diseases. It is important that the government, the PPP civic government, continue to support the health system in the regions. And I would like to acknowledge the donation that is actually coming from the Global Fund. And this ATV will be used appropriately to support the people of the hinterland. Thank you.
Perhaps this morning I'm wearing two hats, that of the Minister in the Ministry of Health, but also as the Chair of the CCM. Because as you know, the CCM here in Guyana, we have 3 programs, and that is one dealing with malaria, one dealing with tuberculosis, and the other dealing with HIV and AIDS. Through the malaria program focuses more on Region 1 and Region 7. And through the program and the evaluations that were done, it was determined that we needed to have additional transportation for staff in these 2 regions. And we are pleased that through the Global Fund that we were able to provide these 2 ATVs. But this is not the only contribution that would be made, because through these programs we're also looking at insecticide impregnated bed nets. We are looking at training for staff, and that's on the malaria side. And on the tuberculosis side, we have some more training for staff, and we are also going to expand dots in those regions. On the HIV side, of course, we continue to work in terms of testing, providing ARVs, and reaching out to persons who are vulnerable to HIV. So the ministry right now, we have a very robust program dealing with our interior, and this is just the beginning of many things that you will see happening in some of these interior regions. But I want to thank the Global Fund for the resources provided so that we can acquire these two ATVs, and the two ministries, Ministry of Local Government and Ministry of Amerindian Affairs, they are here with us this morning because we'll be handing over these ATVs to these ministries who have a larger footprint in the interior area, and we'll be depending on them to help us ensure that these ATVs are properly utilized in the interior. Instead of us trying to take it into the interior by ourselves, we'll be asking local government to help us with that, and they have kindly agreed to do so. So this is the type of collaboration that we want to see going forward. It's one government. The ministries need to collaborate, pool our resources so that we can get the maximum benefit for the people who need these services. So once again, we want to thank all of you for coming. And while this is a very simple and symbolic ceremony, it means that it's probably the beginning of a larger collaboration and cooperation that we'll see between our ministries. So thank you very much.